Well, welcome. My name is Eileen Oshesky. I'm the Chief Engagement Officer here at Aquifer, and I'm so pleased that you're joining us today for our webinar on using formative assessment for efficient and effective clinical. Great to have you here. Today, we're going to talk about Aquifer Calibrate. So Calibrate is a new offering coming from Aquifer, which we're really excited about. It's going to offer high quality formative assessments for learning. So as opposed to assessments of learning, these are going to be really assessments that are helping to shape the learning process. Our Calibrate is going to be coming soon for the courses listed below, and we've got pilots opening very, very soon for our Aquifer Curricular Partner programs. So Curricular Partner programs are programs that subscribe to all 5 of our Aquifer signature courses, and about half of our subscribers right now are Aquifer Curricular Partners. So if you're not sure if you are or not, I'll give some information at the end so you can reach out and check your subscription level. But the Curricular Partner programs often have access to some of the new content that's coming out of our innovation labs, like Aquifer Calibrate. So we'll have pilots for our MD and our DO programs. Those applications are actually opening right now for fall starts of pilots, and our PA and our NP partners will be able to apply to become pilots starting in late in the year or early 2023. So what are we going to cover today? Today, we'll talk a little bit about Calibrate, some of the background, the evidence base, and what is Calibrate, and give you a preview. And then we'll dive into some of the ways to really use it, using Calibrate for coaching, which we're very excited about, integrating Calibrate into your curriculum and how easy it is to administer. And then we'll tell you a bit about the pilot as well. At the end, we'll have about 15 minutes for questions. I'll join you back at that point, and some of our wonderful presenters will be here. So if we move to presenters, I can show you who that is. So we've got 4 great presenters here today. First, we've got Dr. Leslie Fall. Leslie is the CEO of Aquifer. And if you've been involved with Aquifer for a while, you've probably had a chance to interact with Leslie. We also have 2 members of our Aquifer Consortium. As you may know, Aquifer is a not-for-profit, and all of our content is developed, maintained, supported by our wonderful consortium of medical educators. So Dr. Glenn Median is going to be with us. Glenn is the academic director from assessment from the Aquifer Consortium, and he's a professor of pediatrics at Lozano School of Medicine in San Antonio. And Dr. Joe Wayne will be with us as well. He's an assessment lead and a case author on the Aquifer Internal Medicine Board, and he's a professor of medicine and peds at the Albany Medical College. And last but not least, we're lucky to have Anthony Wilson from staff here. And Anthony is our assessment manager for Aquifer. He'll be able to talk to you a little bit about the administration. At the end of the presentation, Dr. Fall and Dr. Median will be available for questions. So if you do have questions, go ahead and drop them in that little corner box at the end, and we'll be able to pull those up, and I'll bring them forward to our panelists, and feel free to use the chat to chat today as well. So I hope you enjoy the webinar. Thanks for joining us, and I'll be back with you in about 45 minutes. Thanks.
Welcome. Thank you for joining us today to hear more about our new transformative assessments for clinical learning. Before we dive into the details of the system, I'm going to start with a brief overview of the reasons behind the development of Calibrate. To be clear, Calibrate is assessment for learning. Moving beyond traditional summative assessment of learning, test-enhanced learning is a pedagogical approach in which students are continuously assessed and reassessed as a formative process. Research has shown that the retrieval practice of taking multiple formative assessments over time enhances students' ability to recall, retain, and apply information over traditional study methodologies. The studied effects are consistent for all health professions, learner levels, formats, and learning outcomes. Test-enhanced learning is useful for helping students identify relatively weaker areas in need of further study, as well as areas of relative strength on which to build further, allowing for more focused and efficient study methods. Test-enhanced learning has also been shown to improve overall student study behaviors and aid in metacognition. Thus, Calibrate does not produce a score. Instead, it produces reports designed to provide students with the data they need to continuously assess and reassess their foundational knowledge and its application to important clinical problems, and to use this information to support their clinical learning and study activities throughout their clerkship rotations. We know that medicine is more than just knowing a collection of facts, despite what it may seem in medical school. These clinicians in training must be able to integrate the information that they've acquired and apply that knowledge to a unique patient and to develop a diagnostic and therapeutic plan. To accomplish this, students must develop the skills of a master adaptive learner, a clinician who continuously utilizes the metacognitive approach to self-regulated learning that ultimately leads to the development of adaptive clinical expertise. These metacognitive skills are deeply supported by an assessment for learning approach, in which learners have the ability to practice and learn, apply what they know and think they know, succeed or fail, reflect on the outcome, and then plan the next steps in their learning. Furthermore, the more objective and targeted the feedback, and the more structure and support provided for reflecting and planning, the more robust the student's skills will become. Given this, why are we not employing formative feedback more often in health professions education? I think we all know the answers to that question. Despite the strength of the approach, there are many real challenges in the way. Our learning environment is often chaotic and stressful, and there are limited opportunities for longitudinal faculty relationships. Students and faculty lack consistent and objective data, and providing meaningful feedback is complex and time-consuming. Study materials that the students use are disconnected from curricular objectives, and meeting accreditation standards for us is resource intensive. Finally, of course, time is always at a premium. In developing Calibrate, we charged ourselves to address many of these challenges for you by providing a high-quality, nationally developed formative assessment system designed for clinical learning. At its core, Calibrate's purpose is to provide students with an objective picture of their knowledge base and applied understanding over time. With so much to learn on each clerkship and limited time, students need to be efficient. Our detailed reports go beyond right or wrong answers. They help identify areas of strength to expand upon during clinical experiences. They provide new dimensions for diagnosing and addressing learning problem areas, including underconfidence, overconfidence, as well as knowledge gaps. With their complete learning picture identified, students are now armed with the information they need to create targeted study plans. Calibrate's detailed results help students take the next step with links to relevant teaching points and Aquifer cases, providing what they need to not just find the answer, but also to understand the clinical context and to leverage this information through their patient care experiences. For faculty and administrators like you, Calibrate provides the tools needed for students to create an individualized study plan, helping to cover accreditation requirements for self-directed learning. Students are learning all the time, and faculty often have no idea what tools they're using or where they're spending their time in learning. Calibrate brings students and faculty together, aligning around a trusted tool with individualized, objective data, enabling deeper teaching, learning, and coaching conversations with more informed feedback on areas for strengths and weaknesses, allowing faculty to provide needed guidance to students as they develop learning plans. And importantly, these processes further support accreditation standards for mid-clerkship feedback. As clerkship directors and educators ourselves, we know you're busy. Calibrate is intentionally designed to extend and leverage what you have already come to value from Aquifer, trusted core clinical content developed and maintained by your peers from your national curricula, now through assessment as well. Calibrate's cohort and program level reporting enables you, too, to assess areas of relative strength and weakness in your own curriculum and program. Combined with the Aquifer cases, these tools enable you to broadly address many of the accreditation standards for curriculum content and management. Calibrate is part of the larger Aquifer learning system, linking to our trusted content and embedded in a platform that you, your students, and your staff are already using. We know you're busy, which is why we've made Calibrate as easy to administer and flexible as possible, with no proctoring required, making it easy to fit the system into your clerkship program and curriculum. As with all of our educational content, Aquifer Calibrate questions are developed and maintained by expert educators. And now I'd like to introduce Aquifer's Academic Director for Assessment, Dr. Glenn Medellin, to tell you more about Aquifer and our Calibrate development process. Glenn?
Hello, I'm Glenn Medellin. I'm a pediatrician and I'm the Director of Assessment for Aquifer. And so I wanted to get into some of the specifics on the Aquifer questions and how they're developed and what their purpose is. So Aquifer Calibrate, what is this? This is going to be some multiple choice exams that are 35 to 45 questions. At the end of each question, the student is going to rate their certainty as to how they felt about their knowledge base going into that question. I think it's really important to know that these questions are pulled from the content that is tied to the national curriculum. These forms are going to be given twice during the clerkship, once early and once late, and each one's going to take about an hour to complete. These assessments are for learning, and specifically for the student's learning. They are formative assessments. The student is going to be able to calibrate themselves against their peers to figure out how well they are doing in mastering the information. These are not summative assessments, so no grades are going to be given. But the student and the course director are going to get very valuable information from this. Rather than just giving a grade or a score, we will be giving progress reports and dashboards to the students that will help them understand their gaps in knowledge and will coach them on strategies for improving their learning. Course directors will also be getting a different report, which will guide them on coaching strategies and help identify students that may be at risk. And we'll talk about this more later. Assessments are going to be given twice during the clerkship, once early on and then again later. It'll be two different forms, but the students are going to be able to practice taking these assessments. This is using the principles of progress testing and spaced practice. And the students will be able to check their knowledge gaps so that they can learn and hopefully perform the way they want and expect on their end of the clerkship exam. And questions will be given in typical online format with vignette, multimedia when appropriate. There will be questions with one best answer, and each question the student will rate their certainty. This certainty rating will allow calibration of knowledge and allow students to identify knowledge gaps. These certainty ratings will be used on the report card, and progress reports will be given to the students. The Calibrate assessment forms are comprehensive in their content. Each one includes 1 to 2 questions from each case, which is 35 to 45 questions per assessment. Aquifer cases are built on learning objectives, which are pulled from the national curriculum. The teaching points is the information that is delivered in each case that informs the learning objectives. The Calibrate questions are developed based on the learning objectives and use the teaching points found in the Aquifer cases. So there is a very close linkage between the Aquifer cases and the Calibrate questions. But it is important to note that the goal of the Calibrate question and assessment process is not to assess students' knowledge only on Aquifer cases, but also to help inform their mastery at the level of the national curriculum. That's because the national curriculum that is developed by the appropriate clerkship director groups informs the learning objectives that informs the development of the Aquifer cases. Many clerkships do not assign all the Aquifer cases, so students might worry that they are being tested on information that is not given to them through the cases. But usually courses and clerkships are developed on the national curriculum, and so many clerkships have innovative clinical learning or didactic sessions, and Aquifer cases are filled into to fill in curricular gaps. So the goal is that the Calibrate performance will inform the student of how they are learning on the national curriculum. It may also inform clerkship directors and course directors of curricular gaps in their courses. Questions are developed and maintained by medical educators. Each of the specialties has an assessment lead at Aquifer that directs the development of questions and other testing material, and then ensures that they are kept current and up to date. And I think it's very important that these questions are developed and curated by medical educators that we know. They are pulled from our national organizations, and each of the specialties has a group of medical educators that has been working hard to write questions, to peer review them, and ensure that we have excellent questions. And I think that this is really important because if students come up to us and complain that they don't like the questions, that they're not at the right level, that they're outdated, all of those things that students like telling us, I think we can come back with confidence and say, we know the people that wrote these questions, we know they're medical educators, and we know that they have developed what they feel are some of the best possible questions over this information. The process of writing a question is we get the learning objectives and identify gaps in our assessments. Our goal is to have assessment questions on all learning objectives in the Aquifer system. The learning objective and teaching point is assigned to a question writer who writes a question to address that teaching point. Once the question is written in a standardized method, it is brought back to the group of question writers who then peer reviews the question. This allows the identification of any flaws in the question. It will also ensure that the knowledge delivered in the question is appropriate for a clerkship level student. And finally, it'll allow the peer review process that ensures that the questions truly are national in scope and do not reflect regional practices. Once the question has been peer reviewed and edited, it's taken on to a validation form so that it can be validated statistically to ensure that the students are performing on the question the way we expected as medical educators. The question is validated using standard statistical methods. And once the question is valid, it is moved to the Calibrate assessment form. So all questions on the assessment forms have gone through rigorous development and validation processes. Once on the form, the questions will be reviewed on a regular basis to ensure that they are still valid, that medical knowledge has not changed. Anytime there are changes to the national curriculum that impact Aquifer cases, those learning objectives will be tagged and all questions on that learning objective will be reviewed to make sure that any revisions based on new guidelines, new knowledge, new curriculum will be updated and addressed. So I hope that you see that through this process of question development and question delivery and certainty rating, we will provide an innovative way for students to learn and assess their knowledge, and for course directors to be confident that they can coach their students and help them learn. Thank you.
Typically, when we think of learning in clinical education, a scene much like this one comes to mind, with an experienced preceptor working with a student to develop and advance his or her patient care skills. We all agree that focusing on ensuring excellence in these observable clinical competencies is the ultimate goal of our teaching and coaching activities. However, underlying a student's observed performance is a great deal of knowledge and information management, applied understanding, clinical reasoning, judgment, and decision-making, and management of uncertainty, all of which we hope is progressively honed and calibrated through experience, personal reflection, and intentional improvement. Through this lens, we as educators must recognize that excellence in the clinical competence we observe, assess, and coach must be built upon a robust foundation of cognitive competence. Cognitive competence in clinical practice is much more than simply the medical knowledge competency most frequently included in our clinical competency frameworks. Cognitive competence incorporates the organization, application, and growth of knowledge, management of certainty and uncertainty, and the problem-solving and clinical thinking skills needed for effective clinical practice. The challenge in coaching our learners towards the development of cognitive competence and their ownership of this journey is that it lies hidden within the mind of a learner, and we as their faculty can't exactly unzip their brains in order to look inside and assess what's going on. It is for this reason that we developed Calibrate. Embedded within the system and reporting, Aquifer's new metric, the clinical learning calibration, provides students with a more granular and useful tool to assess their current knowledge base and applied understanding. This new dimension provides students and their designated clinical supervisors the deeper data needed to better assess and promote clinical cognitive competence. The clinical learning calibration metric is applied to each assessed learning objective, providing item-level feedback about a student's current level of understanding relative to relevant peer benchmarks. The levels are designed to shine a light on both areas of relative strength, known areas of limited knowledge, and, importantly, areas of miscalibrated confidence, both high and low. Targeting feedback beyond right and wrong answers gives learners the tools to transform the feedback into targeted goals for practice, both clinically and through the relevant Aquifer cases. Here's an example of the item-level report that students will see after completing an assessment. At the top, a summary of the student's overall clinical learning calibration results display in a pie chart. To the right, students see their overall learning progress relative to benchmark, indicating their current level of understanding compared to national peers at a similar point in the course, along with a summary and guidance for what to do next. Below is a detailed view that provides students with item-level information about their accuracy, certainty, and clinical learning calibration related to the learning objective, teaching point, and body system of each question, as well as identifying the case in which the material is covered and the status of their case completion. This detailed reporting gives students the ability to see where they nailed it, or where they were accurate but uncertain, or wrong but confident, and to take appropriate action. Additionally, students are able to sort the data in a variety of ways in order to dial in on specific areas of strength, weakness, or misunderstanding. Students can also click to view the related teaching point or the Aquifer case that includes the relevant information, giving them the ability to efficiently self-direct their learning. The most critical component of Calibrate is the student debrief worksheet, which walks students through the process of analyzing and reflecting on their assessment results, noting important patterns where they exist, and creating an actionable learning plan to both leverage strengths and address gaps and areas of miscalibration. The debriefing form is intended to be shared with clinical preceptors, supervising residents, and/or academic coaches, along with the summary assessment results in order to jumpstart a conversation around problem solving and an action plan. To do this, students can also opt to share a summary of their performance directly with a preceptor, faculty member, resident, tutor, or peer, anyone they trust to provide coaching and guidance on their learning journey. Along with summary data about the student's assessment, the self-selected coach also receives coaching tips and access to quick, efficient tools to help them support the student in a meaningful way. Through this series of tools, the assessment, the detailed report, and the debriefing and learning plan, the Calibrate system is designed to identify and then address the most important gap of all, that between perceived and actual cognitive competence. This, we know, is the most dangerous gap of all for our patients, and it is critical that we help our learners identify and close these gaps wherever possible. This is what we mean when we say transformative assessment. Furthermore, the power of the system is fully realized when the dedicated Calibrate assessment reports are combined with the development and implementation of the learning plan, ideally with the help and support of a clinical supervisor and coach. It is in this process where transformative learning truly takes place. Whether students are leveraging their newly identified areas of strength to advance their patient care skills, targeting Aquifer case completion to their real-time clinical experience, prioritizing cases in areas of weakness or miscalibration, or returning to cases to further solidify their knowledge, they are using the system to their advantage. Rather than spending their evenings cramming for an exam from a Q bank, dissociated from your core clerkship learning objectives, students are implementing evidence-based learning techniques targeted and aligned to what you want them to know and learn. From an administrator's perspective, clerkship directors and designated administrators have access to a high-level and easy-to-interpret summary of all student progress within a given cohort by way of the Learning Progress flag. Here you will see students' learning progress flags that indicate students who are doing just fine and those that may be in need of additional coaching or support to stay on track. Clerkship directors and designated administrators will also see student case completion status and coaching suggestions based on each student's clinical learning calibration. It is important to note that clerkship directors do not see the detailed report for each student, allowing students the space to reflect on and plan their own learning in concert with their identified clinical coach or coaches. As a reminder, the Learning Progress Indicator or FLAG found in both student and faculty reports summarizes the student's overall performance on the assessment relative to a national benchmark for students at a similar point in the course. In the early assessment, when a learner's relative lack of knowledge and experience is expected, warnings are only communicated when a learner's overall knowledge base and cognitive competency is very low and or quite miscalibrated compared to peers. Otherwise, a fair amount of knowing that you don't know is acceptable, and the range of learners that are just fine at this stage is wide. Over the course of the clerkship, performance expectations naturally rise, with the levels of performance required for a green flag rising as well. This late assessment and data shared with the student and faculty can help assess critical issues before the final exam, helping students to more efficiently target their studies and helping clerkship directors connect students with the coaching or remediation support they may need. In addition to student summary data, faculty reporting also includes detailed cohort performance results that help identify curricular gaps. Data at the learning objective and teaching point level from late assessments helps faculty find areas that may not be covered as well as expected, or where additional resources might be needed. The ability to compare cohorts in a single clerkship or view data across your entire program provides rich data and opportunities to ensure you're covering core content effectively. In the end, with new data dimensions, quality feedback, and multiple touch points that connect the learner, preceptor, and clerkship director, we aim to build a transformative learning system that drives growth and development of cognitive competence to improve clinical reasoning and problem-solving skills in our learners. We recently shared details on the Calibrate system with our student advisory group. As you can see from the comments here, students understand the value of this new learning tool and how it can help them become more efficient learners. We look forward to gaining more student feedback through our upcoming pilot programs. And on that note, I will now turn the presentation over to my colleague, Dr. Joe Wayne, to talk more about the critical importance of coaching learners to maximize their use of Calibrate's reports, as well as some thoughts about incorporating Calibrate into the clerkship.
So hi, I'm Joe Wayne. I am the clerkship director at Albany Medical College, and I'm also the assessment lead for the internal medicine section of Aquifer. So we've been hearing a lot about how valuable coaching can be in health professions education. For the purpose of understanding and common language, let me take a moment to differentiate between a mentor, an advisor, and a coach. The primary differentiator is who is considered the expert in the relationship. When students come to us for mentoring, they view us as the expert. We have walked the path they are interested in, and they seek guidance and insight from our experiences. Advisors help students with school and program-specific needs, such as scheduling, residency application, and letters of recommendation. Coaches defer to the learner or student as expert because the learner is the expert with respect to their values, strengths, motivations, and challenges. Because of this, the agenda and focus is set by the learner, and they impact how goals are set. The coach then guides the learner through the process of setting and holding themselves accountable for pursuing their goals. One way to check in on whether someone is coaching or not is to observe who is doing the talking. In a coaching relationship, it's the learner that should be doing most of the talking. If the faculty member is doing a lot of the talking, that probably means they are advising or mentoring. Applying the attributes of a coaching mindset will help the coaching relationship become more effective. To do that, it's important to really stay truly curious and explore what is going on with the person you are coaching. And I think that that's the hardest thing, especially as clinicians, because we're all really trained to be fixers. So it can be really challenging to resist the urge to jump right in to diagnose the challenges for them, instead of asking coaching questions like, what's on your mind? What would you like to focus on? What's the real challenge here for you? We need to empower the person we're coaching to solve their own problems instead of managing their process. So now let's loop back to the master adaptive learner model and how Calibrate can help support this learning cycle. Let's begin where the cycle starts, with planning. Learners often skip this phase, but it is necessary for students to self-assess to identify gaps and develop a learning plan. To effectively self-assess, students are bringing together lots of different information, from classroom performance to feedback from preceptors. But one of the best pieces of information is external assessment data. Aided by the debriefing worksheet and guidance from coaches, students can identify gaps and identify actionable plans. Since Calibrate links directly to Aquifer cases, students can follow up easily with links back to Aquifer teaching points and cases to engage in the learning phase. Calibrate fits neatly into the assessing phase when students use the results of the Calibrate assessment to evaluate their progress. After a student completes a cycle of early and late Calibrate assessments with coaching, they will be able to seamlessly enter the adjusting phase by reflecting on their performance, growth, and how they might apply what they have learned to new situations in future clerkships. Let's consider a hypothetical situation. All of your students have completed a Calibrate assessment in week 2 of your clerkship. You are meeting with each student for mid-clerkship feedback. Prior to a coaching session, the student shares their coaching report in debrief form with you. You note in the faculty dashboard that the student had a yellow flag, indicating they are slightly below expected knowledge early in the clerkship. On the debrief, the student identified cardiac management as an area of concern. You recall being told that the ask, tell, ask approach to coaching tends to be effective. So you start by asking the student why they identified that area of overall concern. The student notes that they missed several questions related to cardiac care on the Calibrate assessment, and added that even for the ones they got correct, they had low certainty. You ask whether this matches their experience in the clinic, which they say it does, but the preceptor hasn't mentioned anything. You decide to tell the student that you noticed from their debrief that they seem to struggle on content related to all kinds of patient management issues. The student knows that they thought they were pretty good in that area, and it was just cardiac care, but agree that the Calibrate results suggest otherwise. You ask the student to clarify and set some learning goals to work on before the end of the clerkship. The student comes up with 3 different goals and tactics for achieving them. You let the student know which gaps they should try to fill with Aquifer cases, what will be covered in upcoming lectures or assignments, and what they are likely to see in the clinic. Your energy around that conversation was positive and focused on learning growth. As a coach, you supported the student in an effective self-assessment and in developing a reasonable learning plan. Your questioning helps them dig deeper and identify some additional areas for focus and strategies to add to their learning plan. The ideal scenario may feel far away from where you are right now. Experience with coaching varies widely between programs and faculty. That's why Aquifer is launching a system of support around coaching and the use of Calibrate. For starters, we have recruited a team of faculty peer trainers who will support faculty at pilot programs as they use Calibrate results in a coaching environment. These are accomplished health professions educators from schools around the country that will provide training to pilot schools on approaches to effective academic coaching. In addition, faculty at pilot schools will also be able to access just-in-time tools that make the coaching process more efficient and effective, including agenda templates, goal-setting templates, how to give effective feedback, and checklists for success. Why is this important? It's critical to reinforce the coaching mindset for faculty. Learners need that quality feedback, combined with reflection, to become self-directed master adaptive learners. If coaches fall into the trap of diagnosing students or other common pitfalls, they don't allow students to grow this important skill. That's why coaching is such a critical element in the Calibrate experience, and why Aquifer is committed to not just telling you what the coaching tools are, but providing real training and a support system, making it easy as possible for you to take full advantage of Aquifer's complete learning system. Now let's explore some considerations and suggestions for integrating Calibrate into your clerkship workforce. Let's start with key considerations and examples of what you might find when you think through your use of Calibrate. The first thing I recommend is considering how Calibrate actually enhances or improves what you're already doing. Calibrate can significantly improve self-assessment in students and the development of learning plans by providing an external data point that is aligned with the National Clerkship curriculum. This can enhance your existing coaching sessions and mid-clerkship feedback. You can also replace quizzes and practice exams. if you find the formative focus and detailed feedback a better fit for your student needs. Calibrate can be a beneficial add-on or enhancement as well. Since Calibrate is ready to use, perhaps you can fit in an additional checkpoint that you didn't have the capacity to create from scratch. Calibrate in and of itself is feedback. This additional information about student performance helps build a more complete picture of their understanding. You could also utilize the addition of Calibrate to undertake a more individualized approach to assigning Aquifer cases or other learning tools. Now let's take a look at some of the possibilities for scheduling up to 2 Calibrate assessments. Remember, students have a different set of questions for each administration of the assessment. Here, you can consider your goals and rotation schedule and find what works best for your needs. You have complete control over deciding the timing of the assessment for your students. Early in the clerkship, Calibrate is great for establishing a baseline of knowledge to point out what students may not know early on. Paired with feedback, you can stress the importance of all elements of your course and how they will address these points. An early or mid-assessment can be wonderful fuel for mid-clerkship feedback session, with the timing providing a great checkpoint along the way. An end-of-clerkship assessment can help identify remaining gaps, measure progress, and serve as ideal prep for your final exam. Another important point to consider is who will be on your team for implementing Calibrate at your program. There is flexibility and likely overlap in many of these roles, but here's a general idea of the people involved. To enroll in the pilot, you'll need to identify a Calibrate lead at your program to serve as the primary contact. This person might be a clerkship director, administrator, or other faculty member. They will attend faculty development training, ensure other faculty are oriented and have access to the assessment and resources, and make sure feedback is reported back to us. Clerkship directors will assign assessments and set schedules, view faculty reports, and may participate in the training of coaches. Coaches can be anyone who fits your program structure. The important point is that coaches need to be identified to review results and hold the sessions with the students. Everyone at your program will have access to Aquifer tools and resources for coaching and learning how to use Calibrate. A few more things to help you prepare and help set up your program for success. As always, communication is key. Make sure both faculty and students understand how you are using Calibrate and why, and how it will help improve teaching and learning. In addition to building time for assessments themselves, you may want to consider building in time for self-directed learning. For example, if you're assigning all 36 internal medicine cases, students won't get the full benefit of focusing on their individual gaps. Be sure you're assigning cases intentionally to cover areas not covered in other parts of the curriculum, conditions they aren't likely to see, or bread and butter cases to prep. Give your faculty the resources and tools they need for great coaching sessions. Aquifer and our peer trainers will be providing those tools. You'll just need to ensure access, a short orientation, and we'll recommend some reminders or building it into your existing programs. And remember to think about the big picture. When you're reviewing the results, think about your whole curriculum and help students see where the gaps will be filled, maybe in a lecture, in the clinic, or with an Aquifer case, or another learning tool, or reading elsewhere. It's not just about Aquifer, but the case is here to support you and your students, fill gaps, and reinforce learning. And remember, the overall purpose of Calibrate is to build better, more self-sufficient, adaptive learners. Now let's hear from Anthony Wilson, Aquifer's Assessment Manager, to learn more about the pilot and how easy it will be to administer Calibrate.
Thanks, Joe. I'm Anthony Wilson, Aquifer's Manager of Assessment Operations. I'm here to show you the ease of administering Calibrate for you and your colleagues. The first thing to know is that there's no proctoring required for Calibrate. We wanted to be sure that it was simple to add your course or clerkship. That's why Calibrate can be assigned to your students to fit schedules, yours and theirs. The whole exam request process takes place in your Aquifer account, creating a seamless experience. Students will be able to view their results immediately through their Aquifer assessment dashboard. Faculty with Calibrate access will have immediate access to student reports, providing instant data to guide students. And as always, our team is here to support you with online training resources, just-in-time guidance, and personal support. Here's a preview of the exam delivery request process. As you can see, the form is simple and easily accessed from your Aquifer account. After adding some contact information, you'll select a window of time for the assessment to be made available to your students. Exams can be open for up to 7 days. You'll select the exam, let us know if your students are taking the assessment early or late in the course or clerkship, and then select the students who will be taking the assessment from the list of learners rostered into your program. After you submit, students will receive an automated email notifying them that the exam will be available in their Aquifer account on the selected dates. The email will include links to some of our ready-made student orientation materials. After students complete their assessments, faculty with access to Calibrate can view results for their cohort or view student progress over multiple assessments. As you can see, we're working hard to make it as easy as possible for you and your colleagues to access Calibrate and the powerful reports and data it brings. Now, let's talk more about the pilot program, how it works, who can apply, and what you all really want to know, what's required. You may be wondering why Aquifer is running a pilot program for Calibrate. Our primary goal is simply to test the system with a select group of partners to gain critical feedback on our content, technology, reporting, coaching tools, faculty development training, everything, before we make Calibrate available to a wider group of medical and health professions programs in the future. Our pilot program has several stages. This summer, we will be recruiting medical students during the relevant clerkships to take the exam on their own to help us validate the algorithms that drive the Calibrate system. The real fun will begin this fall. That's when we'll need all of you, faculty from our MD and DO Curricular Partner programs, to participate in the pilot program, have the first look at this new assessment system. Access to the system will start October 1st, with training and orientation happening in advance to help you prepare. Note that although we aim to collect key feedback by January 31st, pilot schools may continue using Calibrate through June 30th if they choose. Once we're underway and systems are operating smoothly, we will be looking for physician assistant and nurse practitioner programs to join the pilot around late 2022 or early 2023. Applications are now open for MD-DO programs. You may also be curious as to why you'd want to participate. The main reason is to gain early access to Calibrate assessments for all relevant clerkships. We're also excited to bring programs into our innovation process to partner with us on the development of this completely new assessment system. Your feedback truly will be driving the future of this teaching and learning tool. Another key point is the access to incredibly rich faculty development resources around coaching. Our team is dedicated to partnering with you to provide the training and tools you need to support great coaching conversations around Calibrate results. And pilot schools will have the opportunity to partner with Aquifer academic leadership and each other on scholarly projects and presentations as we begin to study and develop best practices for using Calibrate. So let's talk a little bit about what's involved in the pilot. We are looking for programs who are willing to use Calibrate twice, early and late, in at least one clerkship between October 1st and January 30th, 2023. We would love to see you use Calibrate across all of your eligible clerkships. Clerkships using Calibrate need to commit to having coaching conversations that include Calibrate results and are at least 20 minutes long with each student. This could be part of a feedback system you already have in place, or it could be a new initiative. Here's an example of what that would look like. Although the timing of assessments is flexible to meet the needs of your program, here's an example of how the requirements might play out on a timeline. Students take the assessment early and complete the debrief and share it, along with the coach report, with the selected or assigned faculty member to review. After that, faculty have an initial coaching session that uses the debrief and results to review the student's learning plan, leveraging Aquifer's coaching resources to structure the conversation. Students are then required to take the late assessment. We recommend they go through the process of completing the debrief and sharing the reports with their coach and having a final coaching session. However, those aren't required for the pilot, but it is great preparation for your end of clerkship exam. Pilot programs will need to designate at least one faculty member per participating clerkship, participate in faculty development training around using Calibrate to fuel great coaching conversations. Online training and resources will be available to any faculty member participating in coaching conversations. Pilot programs will also provide critical feedback to Aquifer by way of completing faculty surveys, helping to ensure student surveys are completed, and participating in a faculty focus group. We hope that many of you will apply to be part of this exciting opportunity. For more details, please review the call for participation on aquifer.org and in the chat. And we look forward to answering your questions about Calibrate in general and the pilot program in the Q&A. And now I'll turn it back over to my colleagues for our Q&A session.
Hi, everyone. Welcome back. I am a little bit green, so I apologize for that. I've been teased that I'm working on my Hulk persona. So I'll try and to fix that, but we'll go ahead and get going, and you're going to just have to see me hulky for a moment. So welcome back thank you for those great presentations, and welcome back to Fall and Dr. Madan, as well as Tracy Kosker is going to be joining us for the question and answer session. Tracy is our Director of Customer Success here at Aquifer. So thanks for the questions in chat, and we had some that were sent in ahead of time. But I wanted to go ahead and start with one about the NBME. We've had a few questions on this, really wondering how the question matches up with the NBME shelf exams for each of the clerkships. And also if you feel that this could prepare students for the step 2 exam as well. So Glenn, do you want to try address that one? And I will try and remove my Hulk-like appearance.
Yeah, sure. I'll try to comment on that. Yeah, so I am the chairing the Children's Health Test Development Committee at the NBME, which is writing questions for step 2, well, for all the steps, and also on the forms committee and item review committee. So I have a fair amount of experience at the NBME. You know, I think one of the really hard things to figure out is exactly what questions are actually going to be on any form. And part of that is that the NBME maps based on their own proprietary curriculum guide, mapping. And they map adult and pediatrics and different types of questions. And so they feel that they have competency when they master over the whole scope of diseases, adult and pediatrics. So that's going to be a different experience in teaching from a clerkship where you're wanting to get scope of material just from the pediatrics or internal medicine or family practice. So saying that we're going to prepare for the NBME is a little bit difficult, but NBME is, it should be aligning to some of these national curriculum. And if a student masters the information that the national curriculum is presenting, we would hope that they will also be able to master the National Board of Medical Exam. So I think that the concept that I want to get across is that we're not testing Aquifer cases and how well a student knows Aquifer. We're trying to test how well a student is mastering the content that is being taught in that specific clerkship or course. And so, and one of the questions also was about how is 30 to 40 items going to be enough to do this? And I think one of the things that we're trying to decide what's the right amount of time to spend on a formative assessment. So one question per case is the scope of the curriculum, but of course, each case covers a whole lot of things and a whole lot of learning objectives. So one question, can we say they truly are mastering? I think that in 40 cases, we are getting to the point where we will be able to start giving students guidance on how they're doing and where they're falling against their peers. And if they do have just some gaps in areas that kind of align with their previous gaps in earlier curriculum. And if through the piloting process, we feel that that's not enough questions, we can ramp up the number of questions. But then, of course, that means it takes longer periods of time. And do we really want our students to be spending huge chunks of time taking multiple choice questions and taking them away from other activities?
That's an excellent point. I remember we actually were debating that a little bit in our student advisory group, and they're like, oh, we want more questions. They say, well, how long do you want to spend on this? And they're like, ooh, it's a really, really great point. Thank you for that. Dr. Fall, I've got two kind of loosely connected questions for you, really about how people are using it in clerkships that might be a little bit different. So one is from David Levine, who says hi to both you and Glenn, and is talking about at Morehouse, where they use the PEDS cases in classroom sessions, but they've got a different order going on so they're wondering, how they could use it. Can they link to certain assessment, or how they can use it if they're using the cases in different order? And the other question that's related to that is people who have a longitudinal integrated clerkship, right? How might they address using these assessments?
Great. Thank you, Eileen. And hi, David.
Mhm.
So I think that, these are really great questions. And I think the important thing to understand about the intention of Calibrate is that it's designed, we call them an early and a late assessment, so that you can understand, so that you can choose sort of how best to use them in your clerkship, rather than calling it a pre and a post, for example. That being said, I think understanding the concepts of a pre and a post assessment, I think help better understand the best application of Calibrate within a given clerkship. So the intention is really with the early assessment to essentially have learners assess a comprehensive taste of all aspects of your national core clerkship curricula in that area. So for example, in Aquifer Pediatrics, the early assessment will give learners a relatively robust, broad assessment of how they're doing in each of those areas. And as you heard me talk about in the webinar, it then allows learners to essentially sort amongst the various reports that they had to see, for example, are they having challenges in health assessment? Are they having more of a challenge in diagnosis questions? Have they completely nailed OB questions or maternal or women's health questions, for example? So the intent in the early assessment is really to help them drive their study areas. So you'll see, I think, when the assessment rolls out, that learners are able to then be able to say, oh, this is the area I really shouldn't actually do cases or questions. I've nailed this. I know this. I'm going to go see patients in this area. Versus areas in which they know they're weak, or areas in which they discover they thought they knew it and they don't. And they know they should really get to those cases, or even get to some Q-Bank questions to really help them better calibrate their understanding there as well. So the intent of the early is really to set the learning plan. And that's why the learning plan and the coaching around the learning plan is so important. It then gives them the course of study, whether your clerkship is essentially 4 weeks, 12 weeks, 8 weeks, to have the learners really dive into the information that they learned from that early assessment, and then take the late assessment to then give them yet another metric or measure as to where they are now after having a number of weeks to really implement their studies around their patients and around their Q-Banks, so they can then have another assessment to understand where their gaps, their additional gaps, might be in that way. So to answer the question about an LIC, for example, for those of you who have an LIC in which the content runs the full 12 weeks, then thinking about an early assessment as it starts, and maybe your later assessment as that content is coming to a conclusion, to again help them better calibrate their studies for your end of clerkship assessment, and or to help them direct their learning along that same path into the later part of the LIC, for example. So that's why, again, we call them early and late versus pre and post. It enables you to sort of figure out where in your clerkship it's best placed to enable that essentially assessment, plan, learn, reassess cycle.
That's great. Thank you. And just to remind people, there's a question in the chat about the timing. So when Dr. Farrell's talking about, setting the two assessments, you have complete control over that, right? So you set the time frame for that first assessment, you set the time frame for that second assessment, and the students can't go in and get it out of the way to answer that question. So thank you for that. We do have a specific question in the chat that Tracy, I'm hoping you'll answer, just about someone else who's got an LIC and the timing is a little bit off and how they might fit into the pilot. So Tracy, if you could answer that right in the Q&A, that would be terrific. Just right in that form.
Okay.
We've got there was another related question. Oh, will the directors be able to see what specific cases have been completed through Calibrate as they're using it? So the clerkship directors.
Right. So the Calibrate, the students in the Calibrate report will be able to see how, whether or not for each of the questions, this is the case that they've completed or where their case completion is. So in the report, the learners had that specific information aligned directly to the questions and their information about each item or each question as well. In the administrator's report, the clerkship director's report, essentially all you'll see in the administrator's report is really your students' clinical learning calibration flag. So red, yellow, green, but for each learner that links out into Aquifer's case completion panel for each of those learners. So there's a quick jump link from a given learner back to their case completion as well. So in essence, yes, it links our two systems and makes that information pretty easy to jump to.
Terrific. Glenn, the next question's for you is really, how do you decide which content should be taught within Aquifer? And, can you share the overall learning objectives or the session learning objectives? How could somebody see those?
Yeah, well, the learning objectives are on each of the cases, and so they can be downloaded from looking at the cases. And so the way the learning objectives were developed, where the national curriculum is looked at and learning objectives are pulled, and then the cases are written. And the content that is taught in the case is the teaching point. And so then the parallel process is questions are assigned to those learning objectives that are for each of the cases. And the answer for each of the questions is found in the teaching point that's taught in the case. So if you want to look at the learning objectives that are being taught and tested over, they are the learning objectives that are aligned for each case. And, Aquifer can help you find where those, to easily access those, but all learning objectives are for each of the cases. Is that and I just want, and so then the student may perceive that as, well, we're testing on case 2 learning objective, development of a child, or case 1, pediatric case 1, jaundice. Well, that was came from the national curriculum. So jaundice is something that should be taught in all pediatric clerkships. And so even if that case was not assigned to a student, because they have a very robust nursery course, that clerkship should be teaching on jaundice. And so definitely by the second course, the student should really be doing better. This does help the student know a little bit by, if they haven't done a case and they didn't get the answer correct, then that's just a learning opportunity. If the student's done the case, they should have mastered that information. And so now if they're missing it, that's more of a red flag issue, particularly if they felt confident in knowing that information.
That's a great answer. And that's really the part of the magic of the system, right? Is that you've got kind of the concept as an example of a national organization feeding the objectives, which goes into the content, which goes into the assessment. You've got a nice closed loop system supporting the learner, the clerkship director, and the faculty. Terrific. Thank you. Thank you all so much. I think we are out of time for questions, I'm afraid, but I know our staff is capturing the questions, and we'll make sure there's some really great questions that I want to get to. So we'll make sure that we get you email answers for those questions and get those shared with folks. So thank you for those. I think we've got just one last slide that I'm supposed to share with you. And we really appreciate you joining us today. So my last slide is really just going to talk about if you have further questions, and Matt, if you could share it for me, that'd be great. There you go. Need to talk. You're wondering, am I a curricular partner? I've got some questions about the pilot, or I didn't get this question answered in my in the webinar. Can you get an answer for me? Kate Hancock and Leah Romano, who you probably know already, you probably have worked with closely, are your secret weapons. Their emails are right there. You can also reach them just by going to aquifer.org and going to support and put in an email that way if you don't remember those. Kate works with allopathic medical schools, and Leah's resource for osteopathic medical schools, PAs, nursing and residency programs. And just a reminder, we offer peer consultations. If anybody's interested in speaking directly with an educator, we can align those as well. So thank you so much for being here. We hope that you got some good information, and we'd love to have you as part of our pilot. Have a wonderful day, everyone.